Good morning, good day, good evening, good night, wherever you are on this round planet we call Earth. Greetings, Earthlings. Back here with an update on my recovery from my injury. I had a distal biceps tendon rupture happen to me the end of July. I had surgery exactly a month ago today. And so it's been a month, which means I have been able to today take off the sling that I've been having my arm in a sling, and I'm allowed to take that off today and actually start moving my arm a bit. So what I can do now is that I can go from keep my arm in 90 degrees has been the regime for the first month here, but now I'm allowed to move it to 135 degrees, which is not as easy as I thought it would be. I was kind of a bit weary about taking off the sling, since I thought my arm was pretty much just going to fall down to 180 degrees, but it's not, because it's kind of hard to get it moving. So I just started my second month of recovery today, which means that during this second month I'm allowed to move my arm to 135 degrees, which is hard, and I'm also allowed to start pronating and supinating my hand, twisting my hand. And since it's the first day, I'm not going to overdo it. I have been trying some today, but I'm just taking it really careful the first day. And that's pretty much where I'm at right now. So with that being said, I just want to say that I've been watching different videos on YouTube with guys with this injury, and there's a lot of different individual regimes to your recovery here, and I guess that's all due to your injury, your constitution, and whatever your doctor suggests. So even if you're watching this video and you watch a lot of different videos, I've seen guys here that pretty much after a week after surgery have full range of motion and can start using their hand. And some people after 3 weeks. For me, it's been a month before I can start using my arm. And I guess you got to make up your own mind about this, but first of all, and most important of all, is that you listen to your doctor, because he's the one that did the surgery on you, and he's seen your arm, and he's attached your tendon, and so he knows. You should probably listen to your doctor. So I'm on a pretty conservative rehabilitation plan here, with my arm in 90 degrees for a month, and now for another month in 135 degrees, and start to get some form of range of motion back in my hand and in my arm. And as you can see, I don't know if it shows well on the video, but you can see that I have lost a lot of muscle mass on my shoulder, on my arm, and on my lower arm. It's pretty obvious if you look at this. If I turn around, this is my left arm and this is my right arm, which is like half the size almost. And with that being said, that's just something you have to take into consideration. That's what's going to happen. If you don't use your muscles, you will have atrophy. With that being said, I realized early during my recovery that as being used to working out 6 times a week, I know that, nutrition and all of that is important for your recovery from training, because pretty much what you do when you work out in the gym and you do hypertrophy training is that you break down the muscle. You kind of get micro injuries on your muscle fibers. And then you eat and you rest, and the muscle will repair itself and add cells to the muscles, and that's how your muscles grow. And so I realized that early in my recovery from this injury too, that nutrition, rest is important, as well as, getting your blood circulation going. So if you're early in your recovery from an injury like this, take long walks, do whatever you can do. Keep a positive mindset. That's what I've done. I've kept a positive mindset, meaning that I've been focusing on what I can do instead of focusing on what I cannot do. Of course, I haven't been able to use my arm, but I have been able to use my legs. I've been working out my legs in the gym now for 2 weeks, and I've been working out my abs. I've been working out my lower back. And I've also been working on my left side, my left arm, my left chest, my left shoulder. I've been working my shoulders without any weights, of course, to keep my arm in the angle that the doctor suggested. but I've been doing different kind of exercises to get my movement back in my shoulder, but without any weights, of course. But I've also been doing some weights on my left arm, because this is something that I picked up on YouTube, is that there's evidence to that if you work your left arm and you visualize yourself working your right arm, you will still have some effect on your right arm. And I actually asked my physiotherapist, I was kind of skeptical. So I did ask my physiotherapist if that was true, and he said it is. It is true, because what happens is that if you visualize yourself working your right arm, your brain, your motor cortex in your brain will send the signals to the muscle, even though you're not doing the exercise, the signals. So you keep your nervous system going, and that will send signals. And I can notice that because I do have the ability to move my biceps muscle. Like I've told you before, I had the same injury in my left arm 7 years ago, and after a month I had no contact with my biceps muscle. I couldn't move it at all, and actually my recovery back then had to start with them putting electrodes and sending signals into my muscles so it started moving. Now I can move my arm. I'm careful with that, of course, but I can move my muscle, I mean. And so parts of my regime at the gym is that I'm working my left arm, not too heavy, but I'm working with weights, and I'm visualizing myself working my right arm. So that's a tip for you. With that being said, it's a long recovery period for me, at least. My doctor put me on this schedule. He said, first month, keep your arm in 90 degrees. Second month, up to 135 degrees, start getting range of motion in your wrist back. And no weights until after 4 months after surgery. So that's another 3 months from now, actually. But like I said, there's a lot of things that I can do, and I'm trying to focus on that. So, and I guess there's no real reason for us to really compare. That's what I did in the beginning. I started looking at these videos on YouTube, and I started comparing with others, and I realized, why can't I use my arm in a week or 2 weeks or 3 weeks? Well, it's depending on your, your own individual physique, your constitution. It's depending on your injury, the size of your muscle. And this is not what my doctor told me. He said, first of all, he said, I had some ruptures on my biceps muscle besides rupturing my biceps tendon. So also my biceps muscle had to heal. That's why I wasn't allowed to move my arm much. Second of all, he said, you have a big biceps muscle, a big, strong biceps muscle. And I actually looked in the journals. He said I had a biceps muscle that's the size of a normal calf muscle, kind of like that. But anyway, so he said, you have a biceps that's big and strong. And to get the aesthetics right, I had to pull the tendon pretty tight. They used the underbutton technique on me, as is the, I guess, normal technique these days to use, is when you attach the tendon to an oval button. You drill a hole in your radius bone, and you feed the button through. You turn it over, and it's attached. The tendon, it's attached with sutures around that button, and so they feed that button down in the hole, and they flip it around so it clicks in the hole, so it's stuck there, and then they attach a screw in the hole on top of that hole. So your biceps tendon is attached, it's stuck there, but it's still a bone that needs to grow back to kind of heal around your tendon. So even though you might be able to use your arm the first few weeks, you still got to realize that when the tendon is moving within that hole in the bone, or when you have movement there, you might affect the healing. I don't know, but my doctor told me not to do any movement the first month. Second month, start doing these things and start moving my arm. I can do full he told me I'm allowed to do full flexation on my arm as far as I can go up, and I can go down to 135 degrees, leaving 45 degrees left, which is kind of hard, I tell you. This is the first day, so I have done some movements, and I do get some pain in the back of my shoulder and in my shoulder, and I guess that's from just keeping my arm up. I've had this sling around that kind of held my arm up before, and now I got to keep it up with my shoulder muscle. So I do feel something in my shoulder. But so the negative part is I've lost a lot of muscle mass on my biceps, but mostly actually on my shoulder and my triceps, because I haven't been able to use my triceps at all, because as you know, you use your triceps to kind of stretch your arm and push down your arm. So I have been trying to kind of push into my hand with my other hand so that I at least get my triceps muscle to move a bit, to get some signals going there. Anyway, I'm trying to keep a positive mindset. I've been back now to the gym every other day for 2 weeks. Feels great. You know, I don't really feel very, you know, put down by the fact that I can't work out my arms right now. I mean, there's so many other things that I can do in the gym, and it's good for your mind to go to the gym. And if you're not a working out person and you had this injury, I guess take long walks will help. That's what I've done. I've been meditating on recovery and healing, and to keep a positive mindset, to have some acceptance in this situation. And that's where I'm at right now. So I'm getting back to start to have some range of motion in my arm, to use my biceps muscle a bit without any weights, and to start twisting my hand, supinating and pronating my hand. And that's been pretty hard. It's the first day, so I guess it's gonna get better. I have my second scheduled time with the physiotherapist on Monday, and I guess I'm gonna get some other exercise that I can do during my recovery and rehabilitation. So that's pretty much where I'm at right now. I'm moving forward. I'm trying to focus on the direction in which I'm moving. I know it's going to be another 3 months before I can lift any weights with my right arm, but in 4 months from now, I will be lifting weights, and next summer, I'll be back. Boom, I'm out.